My name is Dr. Robert Del Junco. I'm Medical Director of the St. Joseph's Nasal Sinus Center. The Nasal Sinus Center here at St. Joseph's has been in existence for about 10 years. What we do is we manage people with conventional nasal sinus problems, anywhere from can't breathe to chronic sinusitis to allergies. And we also deal with people who have snoring issues and sleep apnea because they're somewhat interrelated. The treatment for nasal sinus problems is typically multidisciplinary. It involves primary care doctors, allergists, ear, nose, and throat doctors, and initially they're evaluated by the primary care doctors. And if to be a little bit more specific in the area of nasal sinus problems, most people are plagued with inability to breathe through their nose, postnasal drip, allergic-related symptoms, sometimes seasonal symptoms, and they're treated with conventional medications. And if they're not getting better, then they start to pursue other doctors, and they ask us to kind of chase the etiology or the cause of their problems. And typically that involves, in some cases, allergy testing, x-rays, CAT scans, and if people aren't responding to medical treatment, eventually surgeries. Then they go into what we call chronic complaints. They develop chronic sinusitis. And for many patients, the complaints from nasal sinus-related problems are really not that bad. Most people will tolerate them to a certain point, but as time goes on, they develop chronic disease, polyps, inability to breathe through their nose, and then they eventually have to have surgery. And the initial surgeries that we can do early on are minimally invasive, and if they don't seek attention early on, then they have to have more aggressive surgeries, which is really not the fun aspect of what we do to help patients improve themselves. Balloon sinuplasty is really exciting. I've been in private practice for 22 years. When I was training, we did conventional sinus surgery, and then a new term was coined, which was endoscopic sinus surgery. We used telescopes with microscopic equipment, and we went into the nasal cavity and sinus cavities, and we opened up the sinus cavities. So now there's a new technology which is called balloon sinuplasty. It's taken from the catheters that are used in hearts. So we've taken angiocaths, these little caths that are put up through the blood vessels into the heart with balloons, and what they've done is they've shortened them, and what we do now is in the nose we identify the opening of the sinuses, and we float these little balloons into the sinus cavities, and we dilate the openings, and it's less invasive, it requires less packing, there's less pain, and actually it's a great idea. And that's the future of where sinus surgery is going to go, is more minimally invasive, less packing, less pain. Most of the insurance companies are now on board and paying for this, and so now what's going to happen is typically the surgical equipment, the technology that we use tends to follow some major change. In this case, balloon sinuplasty is opening the door to newer balloons, newer catheters, newer instrumentation to allow us to do more successful surgery.